As a nursing student this semester, I've wondered, what is the role of the nurse in resolving the opioid crisis? Nurses are the most trusted and largest single group of healthcare providers. In this way, they also have a unique ability to influence policy, which we've identified as an important part in solving the opioid epidemic. An important part of the nurse's role is education. Nurses in the inpatient setting can help patients understand the pain treatment options they have and the risks associated with opioid medications. This intervention is known as anticipatory guidance. Because we lack reliable screening tools to identify individuals at most risk for opioid misuse and dependence, the current best practice is to provide this education to everyone receiving an opioid medication. This can also be considered a universal precaution. It helps lessen the impact of a nurse's personal bias on the care provided. All of an accepted universal precaution is for falls. We have all patients wear non-skid shoes or socks and keep the bed in a low and locked position. From here, we can investigate and see if there are factors that may make a person at an increased risk for fall and intervene appropriately. But here, we are providing a higher standard of care and not just intervening for patients who we assume may be at a higher risk for fall, such as those who are older. This change in our approach to education is needed because it helps limit the impact of nurse bias on the education a patient receives. This then raises the quality of care and safety of all patients. These 3 points should be standardly covered with patients who are receiving opioid medications. I believe so strongly in this because I am passionate about providing equitable care to our patients, which is not hindered by the bias that each nurse carries. Alexis Downing is a nurse who has worked in the field of public health for over 20 years. She says the role of a nurse amidst the opioid epidemic is to be compassionate, treat addiction as a disease, be non-judgmental, and learn treatments and resources. To conclude, the nurse's role in resolving the opioid crisis is to advocate for supportive policy, to provide anticipatory guidance to all patients, and to be compassionate.